Good evening, everyone, and thank you for joining us tonight for our 5th high blood pressure workshop. Tonight, we are talking about adherence to high blood pressure therapy. As I've said before, these workshops are done with financial support through a preventative block grant through the Department of Public Health, and we're offering those through the Town of Windsor. These are taped, recorded, and placed on the Town of Windsor website. So for anyone who has been unable to watch or would like to watch again, please check that out and watch it on demand. Tonight's speaker is Dr. Atiq Mirza. He'll be doing the presentation. We'll be recording that. There'll be some time for question and answer at the end of the presentation. That portion will not be recorded. And then I'll be doing a demonstration of the use of the self-monitoring device at the conclusion of the presentation. And with that, I'm going to turn it over to Dr. Mirza.
All right, Jenny, thank you very much for your nice introduction. I would like to thank Jenny, Town of Windsor, and Jose, who is helping us in the background to conduct this show. We will not look this pretty or easy to do all these things if we don't have that support. So my name is Atiq Mirza, and I'm a cardiologist. So we will just set up, okay, there you go. So I practice at Enfield, Farmington Valley in Hartford, and our practice name is Central Connecticut Cardiologist. We are, admit and do our procedure at St. Francis Hospital. So today, as Jenny mentioned, we will be talking about adherence to the hypertension therapy or medications. We did a last talk about hypertension, how important it is to treat and all that. So today we will see how we can help all of you to adhere to the blood pressure therapy, which is very important. So what we will be doing today, to begin with, we will try to define what adherence is. Then we will try to go into details of the problem with non-adherence to the medications, how this can harm you, the society, the family, and our community at large. Then we will be discussing why people do not take their medication and do not stick to the or adhere to the taking medications, and then how we can improve the medication adherence. We will discuss that. So let's first define what adherence is. So adherence defined by World Health Organization from 2003, it is defined as the extent to which a person behavior which can be taking medications, following a diet, or making healthy lifestyle changes corresponds with agreed upon recommendations from a healthcare provider. So this was again described by Agency for Healthcare Research and Quality as the patient conformance with the provider's recommendation with respect to timing, dosage, and frequency of the medications taken during the prescribed length of the time. So this is what adherence means, that you need to take the prescribed medicine, the time it was prescribed for, the dosage it is for, and the time frequency, that how many times that medicine needs to be taken, and for the total length of time, which is mostly lifelong for the hypertensive medications, antihypertensive medications. So one thing I would like all of us to know is that Everett Koop, who was a Surgeon General of the United States under President Reagan from 1982 to 1989, he described it very well. He said, drugs don't work in patients who don't take them. So, and that is the hard truth. If you don't take the medications, you cannot expect to have any improvement of the blood pressure or any disease process for which you take the medications. So if we go into a little detail and, what predicts the adherence? So that is, can be laid down at a multifactorial level, starting from the right in the center. If we see that, from the person who has been prescribed the medicines, and that entails the personality of that person, health status of the person, beliefs of the person, what kinds of attitudes he has towards the treatment and the disease process, and then how good he has organization skills about taking his prescribed medications. Then comes our social context, in which, if someone is elderly, how many family members are around, how is the visual acuity of that person so that he requires help, he does not require help, and then what social barriers are there at the social level so that the patient is not able to adhere to the antihypertensive therapy. Then comes the healthcare encounter. It all depends on the nurses and the doctors who prescribe these medications to the patients. So have these medications been explained very well to the patient? Has patient was told why patient is taking the medications? Has patient told that what disease process is going to be corrected if person is taking the medications? And then at levels at next level comes at organizational levels or at the larger community level, in which, major thing is insurance coverage is adequate for the patient to afford that medicines. Because if that is not there, then whatever he or she does as a patient is not going to work because he can't have the medications. So those are the multifactorial layered factors for which can be influenced the patients for not taking the medications. Let's simplify that a little bit more. At a personal level, what else makes patients not to take the medications? If patients are not fluent in language, whether that English in which the prescription has been written or the instructions on the bottle has been written, and how much proficiency of the language patient has to read and understand the instructions written on the bottle. And then that is associated with the literacy also. Then comes personal mental health issues, like if patient is depressed or is not doing well generally, is not able to get up and get to the bottle, and his anxiety kicks in at times, or there are other addictive behaviors, that is also going to influence patients taking medications or not. Then again, as I mentioned earlier, financial constraints, cost of the medications. And in this day and age, especially in the pandemic, and we have seen that most of our patients suffer through these, that whether they have to decide if they're going to pay their heating bill or their heating oil bill, or to bring food to the table, or they're going to afford their insulin or antihypertensive medications or other medications. So these are the factors which are a great influence on people to decide to take or not to take the medications. Then comes the beliefs in the benefit of the treatment. If a person who has been prescribed the medicine doesn't believe that the medicine is going to help, then most likely that person is not going to take the medicine. Then people are always worried about the unnecessary or harmful side effects. So people may think that these medicines are not helping and they are unnecessary or they are harming their body, and that is also will influence not for them not to take the medicines. Then chronic issues like tiredness of taking medications. If person has been prescribed 25 medications and he has been taking those medications for past 30 years, eventually that person is going to give up and become tired of taking it. So these are the other factors at the individual level. And if we also, as we mentioned earlier, that the cognitive state of the patient, so most of the time when we ask patients then why patient is not taking medications as physicians, and it comes that, most of the patients say that I'm afraid of the side effects. So concern about the side effects is a major concern. Then comes, maybe I don't need that much medications. Then they try to bargain with the dose. If it is prescribed twice, they will take once a day. Or if it is prescribed 25 milligrams, they will take 12.5 milligrams. So that's another thing, but that only comes if they are not convinced that that amount or the frequency of the dose which has been prescribed is needed. Then definitely the cost, as I mentioned earlier, the cost is a huge hindrance in people to get the medicines and take the medicines. The other factors, which are forgetfulness, people forget to take medicines, then the some people who don't have social support, they can't take the medications, impaired cognition, low health literacy, complex drug regimen, high pill burden. And then when patients are not involved or engaged in the treatment decisions, that also sway away the patients from the taking medications. So after that, let's see what happens to a prescription when it's written by a doctor and is given to the patient. Luckily nowadays, that one factor has been removed by the electronic prescriptions, that patient does not get the prescription in his or her hand. It is most of the time directly sent to the pharmacy. But in good old days, only 50 to 70% of the prescriptions were reaching the pharmacy, or if it is given to the patient again, that number still holds true. And once it reaches the pharmacy, 48 to 60% prescriptions were only picked up. And once they are picked up, then only 24 to 30% are taken properly. And after that, if that prescription has a refill, only 15 to 20% are refilled. So those are quite dismal, low numbers, and that increases the morbidity of the disease and by not taking the medications. So now let's see what happens when we are non-adherent to the medications. We can divide them in clinical and health outcomes and economic and social outcomes. So clinically, we can see if patients do not take the medication, what happens? Their health becomes poor. Disease process gets worse. Disease becomes more difficult to treat. Quality of the life of the patient decreases. And obviously, morbidity and mortality increases by not taking the medications. Socially and economically, if we take a look at that, it increases the cost to the healthcare system. It increases the hospitalization, which is again a burden on the healthcare system. And frequent visit to emergency room and healthcare departments, walk-ins also increase significantly. Physicians' office visits are also predominantly increased if medications are not taken properly. Then it's a burden on the society, loss of productivity. People who don't take the medications don't show up for the work as regularly as they should. Now, if we look at further into medication adherence statistics, then 30%, as I mentioned earlier, prescription are never picked up from the pharmacy. And 50% of medications of chronic disease are not taken as prescribed. These are huge numbers. And only patients working with their healthcare providers and nursing staff can improve this, which is going to be a huge success for the healthcare of our patients and decreasing the burden on our already strained healthcare system. An estimated 10% of the hospitalization in older adults are usually considered to be caused by non-adherence to the medications. And these are the scientific studies which have been published in well-known peer-reviewed journals, as I have given the references on the screen for all of you. Then non-adherence to the cardioprotective, which is hypertensive medications, are one of them, increases the patient's risk of death. Can you believe it will increase the risk of death from 50 to 80%, which is a huge number, just by not adhering to the medication regimen prescribed to you? So it is very astronomical number. So we have discussed in our past conversations that there are definite benefits of antihypertensive medications. And even those who are taking the medications, 50% of US adults have uncontrolled blood pressure. And most of them will be non-adherent to their medications. That's the reason it's not controlling it. So as per internal medicine, Annals of Internal Medicine review published in 2017, lack of adherence causes 125 deaths per year. 10% hospitalization, as I mentioned earlier, will be caused by this. And the total cost to the society is around $100 to $300 billion a year. 100 to 300 billions of dollars a year. which can easily give us new schools, bring our people who are living below the poverty line, can provide the breakfast to the children who cannot afford the breakfast, and many, many other benefits. So this is a huge socioeconomic issue. Now let's see which age group, as this data from Journal of Hypertension, data published in 2019, which group of the patients do not take their medications regularly. And if we divide them in men and women, how it differentiates. So if you look at the first bar on your left, which is 58% of people between 18 and 34 are non-adherent. Then the next group comes between 35 to 44. And the most adherent people are 65 to 74. And after that age, again, non-adherence increases, not an exponential increase, but still that increases. And if we see men who are between 18 and 64, they have a higher non-compliance as compared to men who are 65 plus. Women who are at 18 to 64 years of age, they have highest non-compliance rate as compared to the women who are 65 plus. So this is a little statistics I thought that will be interesting to you to know which age group does what and how non-compliant they are. And if we go by the different classes of the medications, which medication classes are people usually do not take. So first thing is, if the doctor has prescribed you a fixed dose, there is a more chance that you will be taking your medication. Whereas if your dose is variable, not fixed, and you are given the charge of deciding when to take and when not to take, that causes the biggest cause of non-adherence. So if we look at this chart, the diuretics are the biggest amongst all the classes of the medications. Diuretics are those medications which make you go to bathroom to urinate more often. And in elderly people, this is quite a big nuisance if they have to take it. And that's why they usually try to avoid these medications so that they don't have to find a bathroom wherever they go. So angiotensin receptor blockers who act on kidney to control your blood pressure, their compliance is highest because their side effect profile is a little better. Then comes your beta blockers, their non-compliance is slightly higher because their side effect profile is slightly worse than the angiotensin receptor. So this gives us all the brief overview of antihypertensive medications non-adherence. Now, looking at this chart, as I mentioned earlier, among young adults, and if the habit is not formed at an early age to take the medication, especially for high blood pressure, it's going to have significant consequences at the end. So younger people have highest non-adherence amongst all. Then different classes have different adherence because of their side effect profile and their mechanism of action, how they work on your body. And there is another interesting fact which I would like to share it with you is those medications who are refilled or filled by retail pharmacies, they have a highest non-compliance because of refilling process. And then, as I mentioned again, if the choice is in your hand to decide which medication to take at what time, or take it or not, that is going to cause the biggest non-adherence. So those are the factors. If you think about that and discuss it with your healthcare provider or your nurses, I think you may be able to tackle this problem and maybe more compliant with your medications. Now, those of the family members who live around or close to or with the people who are on certain medications, I would like to suggest this to them, that you should ask them why you don't take medication. Is it that you forget to take the medicines? Or once you feel better, you don't want to take the medicines? Or if it causes too much side effect, then you stop taking the medication, so that we understand why the patient is not taking the medications, and we can take that information back to the healthcare provider. Now, what can we do to improve this? We have determined that it's a personal issue, which causes personal problem at the personal level, community level, family level, and socioeconomic level. And I feel the biggest problem is at the personal level, which causes increased morbidity and increased mortality, those who don't take the medications. So different people have suggested different ways of tackling this problem of non-adherence. One is that, one should make a log of the medications. But again, it's easy said than done for a person who has zillion other jobs during the daytime to maintain this medication. Nowadays, everyone has cell phones and the digital phones where they can play with the data. So there are multiple apps available now, which can remind you, which can help you put your medications in, send you a reminder, give you an alarm that it's your time for the medications. So these apps have been actually quite helpful in reminding and making people take the medications on time with the desired frequency at the prescribed dose to improve the adherence. Then other things which have been scientifically studied, that if you get a reward in some sense, like if you are taking a blood pressure medicine and you check your blood pressure, which used to be 160 over 95, and after 2 or 3 dosages, your blood pressure has been now 120 over 80 or 120 over 74, 75. So that is a positive feedback to you to keep taking the medication. So for blood pressure, people who have hypertensive, they need to have a blood pressure cuff at home, making sure that they check your blood pressure frequently. And if they check your blood pressure frequently, and then that will help them to keep taking the medications, because that will tell them, yes, the medication which has been prescribed has been helpful. The same way, those inhalers and the blood sugars and the weight management, those all things, which are very helpful if you follow the data of your body and correlate with taking the medications. That is quite helpful in maintenance of adherence of taking the medications. Then next comes the confession. First thing is we need to admit, yes, I have not been taking medications. Once you admit that, then you can ask help from your family, friends, your physician or nurses. Then we are there, your family members, your society is going to be helping you to keep the adherence to the medications. So first step is confession, because as long as you do not admit that you have not been taking medications, no one can help, because people will keep thinking that's, yes, it's the disease process which is not improving, although you are taking your medications. Then comes the communication. Communicate with your healthcare provider. Learn about your medications. Ask your physician and your pharmacist and understand the medications. Why you are taking certain medications. What disease process is this for? How many milligrams you should be taking and how often you should be taking. And then at the same time, when the doctor gives you a prescription, ask the right there and then, doc, is it going to cause any new side effects? Or is this medication which are giving to me has any drug and drug interaction, which is going to cause other side effects in the combination of my other medications? Next, ask your doctor, what's the best time to take the medication? Is it with the food? Is it empty stomach? Is it at the bedtime? Because I can tell you certain medications like those called diuretics, which makes you urinate, those medications are best to be taken early in the morning. So their effect is gone by early noon, and you can run your chores in the afternoon if you have to take those medications. And one thing is very important. Always take your medications list to your doctor. That will help the doctor to know which medication you are taking, how many milligrams of the medications you are taking, how often you are taking. So it's important. And in case he needs to change your medications after you have been adherent to your medications, depending on your blood pressure levels, and he'll be able to tell you how to change the medications or how to titrate the medication to improve your blood pressure control. Then other thing which will help you to reflect upon yourself. Ask yourself, why do you want to improve how you take your medications? Is it helpful to take the medicines? Is the blood pressure is going to cause certain harms to you for which you've got to take certain medications? So for that, you have to think about your disease process. High blood pressure, how is going to impact your health? It can cause stroke, it can cause heart attack, it can cause cardiomyopathy, means thickening of the heart muscle, all right? It can cause stroke. So it can cause eye problems, it can cause kidney problems. So once you're aware of the disease process you're dealing with, that will also convince you to take the medications. Then, as I said earlier, find out how taking medications impact your life. If you have high blood pressure, you will prevent stroke, you will prevent heart attack, you will prevent eye changes, you will prevent kidney failure. So that is your reward of taking the medications. And if you are not able to convince yourself, or you have found the barriers and the challenges in taking medications, do not hesitate to involve others or ask for help, which can be your physician, which can be your nurse, which can be your son, daughter, neighbor, or anyone you can talk to. So this is what is reflecting upon finding out the challenges and then tackle them as yourself or the help of someone. So what helpful measures are there which we can use to improve the adherence? One is, as I mentioned earlier, identify your challenges. What is making you not to take the medicine? Is it the side effect? Is it the price? Is it the not affecting the disease process at all? It's not lowering your blood pressure. And then, as I mentioned earlier, then we need to reflect why these are important for you. Then again, we'll improve your adherence and discuss those challenges with your healthcare provider. One important thing which comes in each and every scientific study which has been done is linking the taking of medications with the daily behavior. Like, before you go to bed, if you go to bathroom to brush your teeth, put your pills with there so that you remember to take them. Any daily activity which you perform, link your taking of medications with those activities. Organize the medications, make a pill box on a weekly basis. If you cannot do it, ask someone to help. Nowadays, there are pharmacies available. They can prepare these blister packs of the medications to give it to you so that you can take the medications on a regular basis. Use the alarms, apps, pill organizers. Those are the different ways you can convince yourself or remind yourself of taking the medications. Again, I will reiterate it again. Do not hesitate to ask for help. Ask for your help from physician, your healthcare provider, your nurses, your family, whoever is there to help you. So organization is very important. Link your medications with your daily behavior, whether that is, picking up your son or daughter from school. Putting the medications in the car is helpful, but again, some of these medications are temperature sensitive, so be very careful. Putting the medication in the kitchen cabinet, putting the medications in the bedside drawer, but again, always make sure you put these medications away from the reach of the children. So I think, asked you enough time that link it with your behavior, with your breakfast, with your brushing of your teeth, before the bedtime, after you wake up, changing clothes, wherever you do routine things on a daily basis. Put your medications around those activities and you will remember to take them. And also make sure you address the other challenges if you have. Price is one of the biggest challenges we face. So please have your doctor, your nurses address it, because there are drug companies who provide you free. There are organizations which help you. And there are always these big drug companies for costly medications. They can provide you medications free for 1 year, 2 years, or like cancer medicine they do, but high blood pressure medicines are also available. Look for the plans, go to different pharmacies, Walmart, Costco, BJ, they all have different, maybe less costlier plans for you to pick up your medications. The other important thing is have a contingency plan for if you are away from home. Some people say, oh, I was on a vacation, I forgot to take the medicines. Always pack your medications. And I tell my patients, when you're traveling out of state, out of country, on an airplane or in a train or in the car, pack your medications at two different places, especially in the airline business. People's bags are lost and the medications are in the bag, you will lose them. So if you have packed them in two different places, at least you will have at the other place your medications available for you to carry. So talking to your family, asking for help, you to organize before you leave anywhere, out of state or anywhere, so that in case you need the medicines and you cannot reach to the medication yourself, someone with you will know where your medication is. Then set up automatic refills with your pharmacy so that you don't have to run out of the medicines before your next prescription is due. In this way, your prescription will be filled. And nowadays, pharmacies are very good to call you when your prescriptions are ready. Now, I wanted to add a few slides for our colleagues and friends in healthcare. Those are physicians or the nurses or home health nurses, so that what we can do as physician or healthcare providers to improve the compliance for our patients. Education, education, education. As your patients know more about the disease process, why he's taking the medication, which medication is for what disease, patient is going to be more compliant. Whenever you see them, do the motivational interviewing with the patients. Try to convince them why they need the medicines, what are the good things about the medications. Ask them about the side effects. Try to, change the medications, have the healthcare provider change the medications if side effects are serious. Address the specific barriers, okay? What are the challenges and the barriers? Then we need to give them the self-management training. And if that is not available, then ask the help from the family so that they can be helped. Then again, make sure you tell them that this medicine is a bedtime medicine, put it in your bedside drawer and take it at that time. This is your morning medications, put it in your kitchen counter. But again, having them in one small pill box is way more convenient for them to take the medications. And the most important thing is, as a healthcare professionals, you can empower patients to take their medications as prescribed. And your impact, your effect is going to be way more than anyone else. Effective two-way communication is critical. In fact, it doubles the odds of your patients taking their medications regularly and properly on a daily basis. Now, what we see common patient challenges, those challenges are, I hate taking pills. It seems like every time I come to the doctor, I get more pills. So to answer those things to our patient, to convince them to listen to them is acknowledge that it's not easy of taking pills on a daily basis. Refocus on why medication is important for the disease process patient is going through. Brainstorm with them that whether the taking with food is going to be helpful, taking at the bedtime is going to be helpful. Encourage them to consult with their pharmacist and pharmacy, and then also help them to decrease the quantity of their pills. There are some long-acting medications, there are some short-acting medications. Please help them to give them the long-acting. Instead of taking 2 pills, they'll maybe get away with taking 1 pill, and that will also improve the compliance. Then patient will come and tell us all the time, I cannot tell that it really does anything. I'm not getting any help from this medicine. It's not helping me. So first of all, acknowledge that. Always give the benefit doubt to the patient and first confirm that the patient is taking the medicine. Then explore why patient's medication is given to him, if it's really not helping or helping. And if it is helping, try to convince the patient and by putting it in black and white in front of the patient how this medication is helping. And Also, again, try to convince them with mutual communication how important these medications are, which medicine is for what disease process, and what other complications which disease process can cause will be prevented by taking the medications. And always, always use a shared decision making regarding those and other trying options. Like, do not just give the prescription to the patient and just tell them that you got to take it. It has to be shared. Sometimes patient will come to you and say, you know what, let me hold my salt for next 6 weeks and see how my blood pressure is. Okay, let's give it a try for 6 weeks, 4 weeks, and come back with your blood pressure readings, and the blood pressure reading is still high, then you definitely need to take the medicine. So that's a shared decision process for our patients. Now, at the end, I cannot, say it again and again enough that taking medication, adherence to the medication is an important in many ways: personal health, disease process, complications from the disease process, social effects, family effects, and socioeconomic effects. Attach the taking of medications to your habit. Discuss it with your healthcare provider. Learn to understand the process, disease process, and how it's going to help you. And try to confess, and if you have an issue of taking medications, not on time, not the frequency you have been prescribed, always, always discuss it with the family members, your healthcare provider, or your nursing staff. So this is what we have for today for how we can adhere to our medications, how non-adherence can cause complications, and what adherence means of taking the medications. Thank you very much. I'll be happy to answer any questions you have. Do we have any questions?
I don't have any questions now. Thank you for the information.
All right. So this will be available to all of you. And no, I know this is not recorded now, but Jenny's here. I think we need to find more ways how we can help our patients to regularly. And it is a mutual working with the patient family and the social entities to do that. So here comes Jenny again, who is going to describe taking blood pressure and the other next programs. Thank you very much.
Would you like to take this?
Thank you very much.
There you go. All right. So as we conclude the presentation, I always like to do the demonstration of the self-monitoring equipment. Remember, I think it was described as when you get up in the morning, make sure that you use the bathroom before you sit down to do this. Find a quiet spot, someplace where you can sit and make sure your feet are flat on the ground, and a place where you have a way to support your arms so that it's about at heart level. This chair seems just a little bit high tonight. You pull out your device, make sure that it gets plugged in, choose the arm. The cord should be coming out the bottom of the cuff, and the cord should be lined up with the inner part of the elbow, which we call the antecubital space. And then tighten it up. And sometimes that wants to twist. Do the best that you can to keep it right there. You might need to adjust and be patient with yourself. Takes a little practice. And then use the device. And sometimes it will record, depending on the type of device you have, you can record for 1 or 2 persons. So make sure that you have that set correctly, whether you're person 1 or person 2, and then use the start button. And I think one of the hardest things to remember is not to talk while you're taking your blood pressure. Once it's completed, you can remove and then record the information. Come up with a system to write down the time, the date, and then the results here with your systolic over your diastolic. And if the machine is also recording your pulse, add that information as well. That is important to do. I also wanted to share with you, I have some educational materials for those of you who've been joining us, whether you've been watching live or on demand. And I think one of the important things that I have included in here after Dr. Mirza's presentation is a pill organizer. So we have one of those for you that has them by the days of the week. And then you can remove each compartment, which then has morning, noon, evening, and night marked. So you can put your pills to organize them based on the time that you would need to take them. If you were leaving for the day, you could take out that day of the week and then slip that into your pocket or purse so that you would have those with you. If you were leaving for the week, you could do the same by taking them with you and then placing this in any kind of luggage with perhaps one day able to put in your purse or your pocket. All right, so I have sent out an email to many of you who've been attending our programs to do a curbside pickup. We're keeping with the pandemic and pick up on, I believe I said Friday between 11 and 1. Just give us a call and we'll come down and bring that to you. And if anyone has been watching this on demand, we'll be sending out some information on a form for you to complete so you can, or we can contact you, and then you can do the same with the curbside pickup. All right, if there aren't any other questions, I think we'll draw this to a close this evening. Any
Thank
questions?
you.
All right, well, we hope to see you next week as we finish our series this year with urgencies and emergencies regarding hypertension. Thank you and good night.
Good night.